The Lagos State Governor, Babajide Sanwo-Olu, earlier this week unveiled a policy document on safe termination of pregnancies. Reactions have been trailing that development, especially from concerned groups and individuals who say this could be the start of legalization of abortion in Nigeria. But joining us now to throw some light on the new policy is Dr. Folashade Oludara, who is Director of Family Health and Nutrition, Lagos State Ministry of Health. Good to have you, and thank you for joining us on Newsday.
Thank you for having me.
It's a pleasure. Now, I'd like to start by asking you about the nature of the pushback that you might have received as a result of the provisions of these guidelines and any that you might anticipate in the near future.
Yeah, the pushback on the newly established guideline for safe termination of pregnancy for legal indication actually experienced a lot of pushback from the public. But the good thing is that right now we've concluded the final document, and everyone is happy because of the reason behind having to develop this guideline. A lot of women die. We all know. Currently, the current statistics says about 287 women die globally from pregnancy-related diseases, pregnancy-related conditions. And out of that, about 14% of that, which is well over 40,000, die as a result of abortion. And whether it is procured legally or illegally. And in this part of the world, a lot of things are hidden in our legal documents that people prefer to run away from, rather than making an attempt to provide these services in a safe manner. So majority of these women of childbearing age, once they are pregnant, they have unintended pregnancy, all they do is to procure abortion in an illegal way. And as a result of that, that increases our maternal mortality indices. And that's one of the reasons that pushed the Lagos State to develop this guideline. Is a guideline that provides a tool that health workers, healthcare providers can use to give services on safe termination of pregnancy under the legal indication. The law of the land, which is the law of Lagos, the criminal code of Nigeria, is there. However, which that criminal code provides opportunity for every woman to, for the provider, the healthcare provider, to give abortion to a woman if that pregnancy is a risk to her life. And the revised Lagos State criminal law, sections 145, 146, 147, and 201 actually, expressly state that abortion could be given to a woman under a lawful condition, to be able to save her life. That's number one. And also, if it endangers her medical or physical health. And by physical health, we mean some medical conditions that are incompatible with either the mother getting the pregnancy to term or the baby surviving. So there are two things there. The life of the mother and the life of the baby is also important. If the mother has a condition that is not compatible with the survival of that child, the law also provides that type of removal of pregnancy under a safe condition. And as we all know that abortion could either be spontaneous or induced. We are talking about legal abortion, legal induced removal of termination of pregnancy that endangers the life of the woman and the physical health of the mother. Thank you.
Now, we know that access to safe abortion care for non-medical purposes or for a pregnancy that did not result from rape or incest is outlawed in Lagos State. Yet there are hospitals who carry out this unlawful procedures. So what measures have you put in place to identify and also sanction such hospitals?
Just as I've said earlier, those that provide the services illegally do it under the cover of the hospital. It's not known to the public. However, there are laws guiding the private sector, for instance. The government sector, before the establishment of this, the dissemination of this guideline, none of our government hospitals actually provide such services. But the private, obviously, some provide, but however, they provide it illegally. And we have the Air Facility Air Facility Accreditation and Monitoring Agency that is on top of that. You are supposed, as a healthcare provider, you are supposed to know your limitations. Even procuring abortion is not for every healthcare provider. For instance, if you are not trained to do it, you are not expected to do it. And it has to be within the legal framework of the Lagos State Criminal Law, year 2020, 2011 Lagos State Criminal Law. Anything outside that, outside what the law says, then it becomes illegal. And anybody who is caught will face the wrath of the law.
But how do you
Because
enforce that law? That's what I want to know. It's a different thing to just bring out a policy or have to say there's a law, but is the law enforced? That's what I want to know.
Yes, the law is there. A law is a law. You know, Lagos State is a sovereign state that actually has the right to have its own law. We have the year 2011 Lagos State Criminal Law. And that law is well known. It's just the interpretation that has been ambiguous, you know, for a lot of law enforcement agencies. And part of what this guideline is providing is to provide a safe place in which they can consider the conditions in which can be considered as endangering the life of women. If you look at the guideline that we just disseminated, it has about 7 sections. The first section is introduction. It has the various sections that talks about the legal implication, the law itself. It talks about what your limitations are and the conditions in which you are supposed to consider for procuring legal abortion. And it talks about the type of care you are going to give to the women before and after. And it talks about ensuring that you do the appropriate medication or test or carry out a lot of laboratory diagnosis before a decision is made. And you must get the consent. And those are the contents of this guideline. The guideline is to remind the healthcare provider who is providing this that these are the guidelines that covers, these are the conditions that the law covers. Anything outside this condition, the law does not cover it. Like there are some penalties in the law, the criminal law of Lagos State, for those that are procuring abortion, for those that are providing.
Dr. Folashade, sorry about that. But if you can still hear me, I want to ask about the timing of the release of this document. As we all know, it has been all over the news with the recent...
And for those that are to every healthcare provider practicing within the Lagos State, so that they don't fall foul of the law as they are providing the services. A lot of credible healthcare providers run away from providing these services because of the ambiguity of the law before this guideline was instituted.
Right. Dr. Folashade, sorry to interrupt you. For the sake of time, I want to ask about the timing of the release of this document. We know that women have had issues. This has been going on for quite a while, but we also know that the U.S. Supreme Court had overturned their landmark ruling of 50 years, Roe versus Wade, and that made quite a splash in the headlines, albeit around the world. Is this a correlation between the two? Because we're wondering why, amidst the many issues that Nigeria is plagued with at this particular time, this is what is being discussed, women's reproductive rights.
Yes, I want to say that on that, the guideline actually went through series, of procedures. We didn't just arrive at this guideline. The procedure actually started in 2018 when the federal government established the same guideline on safe termination of pregnancy for legal indications. However, Lagos State, having disseminated that document at the national level, Lagos State took it upon itself to domesticate it, to the best of our own, for the benefit of our people and to save as many lives as possible. Every year, over 40,000 women die from unintended pregnancy, and 59 of every unintended pregnancy who results yearly basis to 59% results into abortion, which could either take away the life of the mother or give her another complication that she did not bargain for. So we know that it is high time, and we took along all the various stakeholders, starting from religious leaders that have been major contenders, the community leaders, even the community faith-based organizations were involved at the beginning of the dissemination of this document. And all the professional bodies, the Pediatric Association of Nigeria, the SOGON Association, UNICEF, WHO, all our development partners. So it's not a Lagos State affair alone. It's actually all encompassing. It's a
Well, thank you so much, Dr. Folashade Oludara, for that.